All right, today we're going to tackle a big one: ADHD, or attention deficit hyperactivity disorder. You've definitely heard the term thrown around, but what it's really about is, well, way more complex and nuanced than most people think. So let's break it all down: what it is, and just as importantly, what it isn't.
You know that feeling when your brain is like a web browser with a million tabs open, all playing audio at the same time? If you can relate to that, you've just scratched the surface of a core challenge for so many people with ADHD. It's about so much more than just getting distracted. It's a constant, everyday struggle to manage focus and attention. So here's our game plan. We're going to start by just decoding what ADHD even is. Then we'll look at the different phases of ADHD, how it can show up. After that, we'll get into what causes it, check out the pathways to support, and finally, see how it changes throughout a person's life.
Okay, first up, decoding ADHD. Before we jump into all the symptoms and treatments, we really need to get a handle on what's going on at a fundamental level with this neurodevelopmental disorder.
So, what are we actually talking about here? ADHD is a developmental disorder, and it messes with the brain's executive functions. Now, think of executive functions as your brain's air traffic control system. It's supposed to manage everything: organizing your day, controlling impulses, regulating emotions. When that system's wired differently, it creates huge challenges. And get this, it is way more common than most people realize. We're talking about 1 in 20 Australians. But honestly, that number is probably low. Why? Because ADHD often gets missed, especially in girls and adults who don't fit that classic stereotype of a hyperactive little boy.
And that actually brings us to a really important point. ADHD does not look the same in everyone. It's not this one-size-fits-all thing. It's more of a spectrum with three main ways, or faces, that it can present itself.
All right, first up, we've got the inattentive presentation. This is what some people might call the classic daydreamer. The main struggle here is with focus and staying organized, often without any of the obvious hyperactive behaviors.
So what does that look like in real life? Well, it means starting a dozen projects, but finishing maybe none of them. It's your mind wandering off in the middle of a conversation. It's struggling to manage your time, constantly losing your keys or your phone, and finding it almost physically painful to focus on anything you find boring. Okay, next we have the hyperactive impulsive presentation. This is probably the one you're most familiar with. It's the stereotype we often see in movies and TV. It's that person who seems to be constantly in motion, always acting on impulse. Really, the key thing here is the brain's brake pedal isn't working the same way. This can show up as constant fidgeting, talking a mile a minute, interrupting people, or just blurting things out without thinking. For them, boredom can feel completely intolerable, which sometimes leads to risk-taking just to get that stimulation. And then there's the third type, combined. And just like it sounds, it's a mix of both inattentive and hyperactive impulsive symptoms. This is actually the most common way ADHD shows up. Okay, so we know what it can look like, but why does it happen? Understanding the biology here is so important because it helps us move past all the myths and get on the path to a clear, proper diagnosis. Okay, this is probably the most important thing to get straight. ADHD is not a character flaw, it's not a result of bad parenting, it's an inherited disorder with a real biological basis. We can actually see differences in brain structure and function. And while genetics are the biggest piece of the puzzle, other things like premature birth or early trauma can also contribute. All right, let's clear something up right now. This is the difference between having an off day and having ADHD. We all get distracted sometimes, right? But with ADHD, the key words are persistence and impairment. The symptoms are there day in, day out, and they cause serious problems with school, work, and just life. And because of that distinction, a diagnosis isn't just a quick checklist. It's a serious process. A professional will look to see if the symptoms have been around for more than 6 months, if they started before age 12, if they're not what you'd expect for someone's age, and this is the big one, if they cause significant impairment in multiple areas of life. So once a diagnosis is in place, that's when the journey to support really begins. And listen, the goal here isn't to cure ADHD. It's about finding strategies and treatments that help people manage the challenges so they can absolutely thrive. And it's not about finding one magic bullet. It's about building a whole toolkit of strategies. The best approach is a combination of things, tailored to the person. That could mean medication, therapy like CBT, family counseling, school support, and even looking at nutrition. It's all about finding what works.
Okay, let's talk about medication, because I know there's a lot of noise out there about it. But the research is incredibly clear. Stimulant medicines have been studied for decades. They are considered safe, and for a lot of people, they are incredibly effective at improving concentration and helping with impulse control and hyperactivity.
All right, our last big section. Let's talk about what ADHD looks like as people grow up. See, it's a lifelong condition, but it's not a static one. The challenges change and evolve, and understanding that is key to giving the right support at the right time.
You see, in a little kid, it might look like classic hyperactivity, and they'll need clear routines. But then as a teenager, that energy kind of turns inward. It shows up as chronic disorganization, procrastination, and can really tank their self-esteem. By adulthood, those struggles can impact their career, their family life, and often go hand in hand with things like depression and anxiety.
And this is a really, really big deal. ADHD almost never shows up to the party alone. In fact, only about a third of people have just ADHD. The other two-thirds are also dealing with other conditions: anxiety, depression, learning difficulties, autism, you name it. And that's exactly why getting a full, thorough assessment is absolutely critical. You have to see the whole picture.
All right, so let's recap the big stuff we've covered today. First, ADHD is a real biological condition. It's not an excuse. Second, it shows up in different ways: inattentive, hyperactive, impulsive, or a combo of both. Getting a proper diagnosis from a professional is the essential first step. From there, a whole toolkit of treatments and strategies opens up. And remember, it's a lifelong journey, but support is available at any age.
So that leaves us with one final and honestly pretty massive question. Understanding the what and the how of ADHD is one thing, but the next step is on all of us. How do we take this knowledge and use it to build schools, workplaces, and communities that don't just put up with neurodiversity, but actually embrace it? That's something to think about. Thanks for tuning in.